Hi, everyone. My name is Leah Wyrick. I'm the CEO and founder of Three Strands Recovery Wear, and we're so excited to have you here on our first podcast series with Miss Jill McNeely, who is a retired breast nurse navigator. The goal for this podcast and blog today is to describe the important role that a nurse navigator can play in your breast cancer journey from the time of diagnosis, treatment, and recovery. Miss Jill McNeely is a very special person to my mother and I, as she was my mom's nurse navigator when she was diagnosed with breast cancer in 2016. She has had over 11 years of experience being a breast nurse navigator, has her master's in nursing education from Duke University in North Carolina, and over 47 years of nursing experience. I want to pass it over to my mom, Nancy Wyrick, who was a big part of Three Strands Recovery Wear and the product that we created, the Resilience Bra, based on her diagnosis with breast cancer. I'll pass it over for her to introduce Jill a little bit more.
Thank you, Leah. Hi, Jill. Thank you so much for joining us today. We are so excited to have you here. And I'm just going to say a couple things about my experience with Jill. Jill was the individual who told me, along with the radiologist, that I had breast cancer. And I get chills kind of thinking about it because, if you've heard those words, you know how hard it can be. And what I appreciated about Jill and what I know from friends and others who have also had that hard conversation with Jill has always been her hopefulness, her candor, encouragement, and knowledge. So she immediately told me exactly what I was dealing with, what she felt the treatment options would be, although, of course, that's going to be left up to the physician. But her expertise and experience in this world of breast cancer and such a guiding force for so many friends that I have in this area that have worked with her. I'm just really excited that you have been an early adopter of the Resilience Bra. You've been working with Leah from very early on and in this product. And I know that you've recommended it many times to your friends and family. And so that's another reason why it's so important to have you as a partner across everything that Three Strands is working to do. So I'm going to turn it back over to Leah, and Leah's going to start with a few questions that are really targeted towards what exactly is a nurse navigator and why it's important to know about that role once you've been diagnosed, and just a few key questions. So Leah, over to you.
Absolutely. Well, we are excited to get started. And Jill, we're ready to give you the floor. Can you tell everybody a little bit about your experience in breast health?
Thank you. And Nancy, thank you for those kind words. I started in breast health in 2010. Navigation was really kind of in its infancy. And our small community hospital decided that that was an important role to have in our hospital. So I spent some time with two major medical centers, kind of learning what that needed to look like, and was very fortunate to work with surgeons, oncologists, and administrators who said, okay, go to those two sites and make it ours. So
Mm-hmm.
that's what I did. I brought it back to Rowan, put the patient in the center of that wheel because they are what turns that wheel. Then, together with surgeons, oncologists, pathologists, devised a patient center plan with the key points being diagnosis, assessing the patient to get key appointments for them, preoperative stage, postoperative stage, and then treatment and recovery. This is where I met Nancy, and through her journey is where the Resilience Bra began.
Yes. And you have played a key role in about every piece of that. And, I know mom was diagnosed whenever I was 16 years old, and I had the pleasure of getting to know you since then. And now I'm 24. So we have come a long way, and you've played such a big journey in mom's recovery, as well as, the development of the product. And so, I think that it's really important that we are able to share a little bit more about exactly what a nurse navigator is and do hospitals typically have one? So can you describe your role as a nurse navigator, what you kind of did on a daily basis? And does every hospital have someone like you in there?
My role as a nurse navigator, meaning that I helped patients through their journey, what they needed for their care. I explained in detail their diagnosis. Most women are just shell shocked when they hear those words, "You have cancer." And
Right.
sometimes they don't hear anything after that in that appointment except for some snippets. Everything that I tell them in that initial appointment, they will hear again from their surgeon and their oncologist. So that's just the beginning of the journey. I make sure that they have their initial appointments to see a surgeon and an oncologist, make any appropriate referrals, and those may be to genetics, maybe to financial counseling, may just be that support the patient needs. It's hard to completely define what a nurse navigator does because it does change for each patient. It's not cookie cutter. Um, my patients, I think, always knew that my door was always open and that there was no dumb question, just one that kept them awake at night. In
Yeah.
fact, oftentimes I'd say, "You can call and leave a message on my phone at 2 in the morning. It will not wake me up, but I will hear it first thing in the morning." I never left my office with my voicemail light on. I always make sure that I return those phone calls. In terms of, does everybody have a nurse navigator? Not necessarily. But let me back up one minute and just kind of give you an example how that role changes for different kinds of patients. So, if we compare a 68-year-old retired woman who has a husband and grown children, and a 40-year-old single mother of three
Hmm.
who is the sole breadwinner in her family, their needs are going to be completely different, other than the fact that they both have breast cancer. One may not need support, and one may need a ton of support, both financial, psychosocial, transportation. And it may be that older adult that needs more help because the younger person may be very computer savvy
Right.
and be able to get things that way. So you can't really compare them. They're just not apples and apples. Does every hospital have a navigator? Absolutely not. It's not a requirement, but if they are oncology certified facility or an NAPBC qualified facility, they do have navigators because that's one of the requirements. If there's not a navigator, we've got lots of other things we can do to deal with that and online things. Locations of that navigator may be in the mammography office, in the surgeon's office, in the oncology office. That can vary from facility to facility depending on where the focus of that is. Ours at our facility was in the mammography department.
Mom, I don't know how you can kind of describe your experience whenever you were in the mammography center and kind of how you met Jill through that. But do you remember kind of your experience whenever you saw Jill for the first time or walked into the clinic?
Yes, I had heard of Jill. I'd had friends who'd had breast cancer, and um I knew kind of what she did in terms of being that first point of contact. And when I went in for my follow-up after my mammogram, I had seen her name on my file, and I kind of got a pit in my stomach, I'm not going to lie. Because I knew that may or may not be the best thing, that I was going to go see Jill more than likely. But like I said, I like straight shooters, and Jill was a straight shooter, but also in a very empathetic and caring way, and I respected that. So, like I said, that was my first experience, and I found her being extremely helpful in terms of my point of contact going forward. If I had a question, if I was mulling over treatment options, Jill walked me through them. And so I really think that nurse navigator role, if you have one, is going to be that person that you can get, that is accessible, maybe more so than your doctor, nurses that are part of that practice. But Jill was, like she said, it was never a dumb question. I asked her everything and anything I could.
And I really think that kind of helps lead us into the next question that I have for Jill, because Jill, my mom was one of probably thousands on thousands of patients that you've seen in your time as a nurse and a breast nurse navigator. And I know that her interaction may be similar to how you worked with others. It may be a little bit different, but can you help kind of everybody understand why it's important to work with a nurse navigator? I think Nancy has kind of alluded to that already. And kind of what should patients expect when they're meeting with you?
Well, I think for the main thing is it's a point of contact. It's that person who can be the problem solver. They're a patient advocate. Their job is to help the patient. Most of the times they don't work for the surgeon or the oncologist, they work for the hospital. You have to give hospitals a lot of credit. It's not a reimbursable charge. So
Right.
our hospital chose to employ me as a service for women, which to me said a lot. The nurse navigator is if a patient doesn't like a doctor's appointment or goes to see a doctor and she doesn't care for them, she can call the nurse navigator. The nurse navigator can make another appointment with someone else. Or, like I told patients, I said, it's always okay to have a second opinion. The nurse navigator can set up that second opinion. They can make sure that that patient gets a bra fitting before they go to surgery when they can fit them correctly. I think the biggest thing is they're there for the patient.
And you have been there for many, many patients. Do you have an idea for how many patients you've worked with specifically for breast cancer over the last 11 years?
I don't. It's way over 1,000.
Yeah.
You know, I got as much from that as I gave.
Mhm.
I met some amazing women and have formed some long lasting relationships, even though you're probably not supposed to as a nurse, but sometimes you just find a kindred spirit. I have made some good friends and I've cried with some patients. I've cried seeing their pathology come across my desk, knowing that that was going to be a journey. And you just kind of have to put on that face and go, okay, we're going to get you through this.
Unfortunately, there's not everybody is going to have access to such an amazing person like you that can really help be that point of contact and navigate them through this difficult journey. And I think it's important, and something that we've talked about before is, if you don't have a nurse navigator, who are your key contacts? Who should you talk to, and kind of where should you look?
First and foremost, whoever gives you your diagnosis, make sure you get a written copy of your pathology because that's going to contain all the words that you're going to hear and need to see. Even if you go online, and there are lots of good online resources, but without a copy of your pathology, you have nothing to go back to. The other thing is, I say, when you see your doctors, get the name and phone number of their primary nurse. That's the person you're going to talk to. Your physician absolutely may call you back, but if you can get through to their primary nurse, lots of times they can answer your question. Each doctor is different. You know, if you don't have a nurse navigator, there are online resources. There are online support groups that are really good. Don't discount going online, but just make sure it's a reputable source. If you go online to an online source and it doesn't feel right, get out of it. Not enough time for you to learn all the things you need to, but there are plenty of people who can help you with that.
Mom, and I know that this was something that you also did. You tried to be some of that Google MD a little bit because
Oh,
you
of
like to do
course.
research. Can you talk about your
Yes.
experience and kind of when you knew I need to back off and kind of trust and call my key personnel that could help me get
Yeah.
through this?
I think we all, if we faced a health diagnosis, it's a natural instinct, and you do a little bit of that, and then you just have to bring yourself back out of that and say, it's time. It's time to go. I mean, it's time to fight. It's time to go. Let's get this thing done. And I love what's happening here because a lot of these things we talked about, Leah, in previous podcasts, has been we women need to know what to expect. This is exactly what we're talking about, what to expect. So I know Jill's going to be joining us more to help us. You know, we've only taken it one little slice today, so we're going to continue to build it out a little bit more to help women know what to expect.
Absolutely. And that's a great, Jill, do you have anything else you want to add?
I think sometimes getting some good written material.
Yeah.
We gave all of our patients Judy Nietzsche, Kneece, breast cancer book. That is who I learned from. And it's a very well written book available on Amazon ebooks.
I have that book.
Yep. I
Yeah, and
gave
you
it
walked
to
me
you.
through it. Yes, you highlighted it. You took me right to the type of cancer I had and things, elements of it that were most important for me to take away with from that initial discussion. And I
And
still have that book today.
And I think those are things that are important. You know, I would tell patients, don't read through the chemotherapy section. Don't read through this. You're not there yet. Let's get through the beginning part. And that's kind of where we are today with our discussion.
Well, that is a link to a book that we will put down below so you guys have access to it if you want to share it with your healthcare professionals and kind of maybe help guide you through what to look at in that written material that can help you as you are researching. So, finishing off this podcast, I want to thank Jill. Thank you so much for your insights and your experience and how many women that you've helped in your time as a breast nurse navigator. And we look forward to the next episodes. This is just one of a 5-part series we will be doing. The next part is going to be focusing on kind of that waiting game. The waiting game is the hardest part. What are some things that you can do in between your diagnosis and your treatment? And then also having Nancy kind of share a little bit more about her journey and the importance of emotional support. If you have any questions or want to learn more about 3-Strands Recovery Wear and the Resilience Bra, please visit www.3strandsrecoverywear.com or email us any questions at info@3strandsrecoverywear.com.